Okay, good. I'm Ted Struley. I'm the editor and associate publisher here at the Journal-Record, and we're talking to New View, Oklahoma today. We're going to ask everyone at the table to introduce themselves, starting with Lauren Branch.
I'm Lauren Branch, and I'm the president and CEO at New View, Oklahoma.
And I'm Kathy Holden. I'm the Senior Vice President of Rehabilitation and Clinical Services at New View, Oklahoma.
I am Roxanne Mayrose, CEO and President of Vision Serve Alliance.
I'm Judy Riley. I'm the low vision optometrist for New View, Oklahoma in Tulsa.
I'm David Leverance. I'm currently Assistant Professor of Ophthalmology at the School of Medicine at the University of Colorado.
Okay, thank you. Let's start. Lauren, maybe you're the best one to put this to. Can you just tell us a little bit about New View's background, how long you've been around, how long you've been in Oklahoma?
I sure can. So New View, Oklahoma has been in our community since 1949. So we're a long-standing nonprofit organization. We provide specialized services for people who are losing their vision or who have lost their vision, and we're also the largest employer of people who are blind in the state of Oklahoma. So, our programs and services serve babies to grannies, like Roxanne likes to say, and everything in between. We're the only private agency that provides comprehensive services for people with vision loss.
And how many people do you serve about?
So we currently, our client base is, Kathy, almost 5,000 individuals. Yeah. We serve statewide in all 77 counties, and I think at the last tally, had about 152 employees.
And you have clinics in Oklahoma City and Tulsa, is that right?
We do have clinics in both Oklahoma City and Tulsa, and like I said, we provide itinerant services across the state.
Okay, great, thanks. Just a little more for background, and maybe any of the three of you might address this, but can you tell us a little bit about what we mean when we say low vision and uncorrected vision loss? In layman's terms, what are we talking about?
Well, we're talking about vision loss which cannot be corrected with either medical means of surgery or medicine or with correction of refractive error. And I think the important thing to remember also is that it doesn't just take one form. There are some people who have loss of visual acuity and have trouble seeing detail. Other people have loss of visual field, and they might be able to see detail, but they don't see far off to the side. Others with contrast sensitivity loss. So visual impairment affects many different people in many different ways. And so that's really important to recognize too, to understand the whole picture. But we used to think that it, and still to some degree do, that it has to affect both eyes, but we're also discovering that the loss of vision in one eye is a big adjustment for people to make as well. And we actually have a program where I work where we help people with that type of an adjustment. But it usually, the definition usually requires that you do have vision loss in both eyes, because if you have good vision in the other eye, you can usually function pretty well, but it can be a really tough adjustment.
So we're largely talking about the clients you serve have significant enough vision loss that it's impairing their ability to function in society, to
maintain their jobs, to hold their jobs, or for children, for instance, to be able to compete along with their peers, to be able to go into a classroom in any school and really do the same things that their peer would be doing. And so a vision loss that impacts their ability to read. As kids get older, for instance, the print gets smaller, so it gets more difficult for our kids to be able to compete that have low vision. And often they fake it till they make it, and so they don't want anyone to know they have a vision loss, and so they won't ask for help either. Same with our seniors. They don't want to be placed in an assisted living center, for instance. They want to stay at home, but they're afraid if they convey to their family members that they're struggling seeing the microwave or cooking a meal, that their family members are going to get concerned for their safety.
Okay. And how, you mentioned children, I read somewhere some percentages on children in different age groups that are affected and that New View serves. Can one of you give us a little breakdown of roughly how that shapes up so we get a kind of a mental picture?
We're having a hard time identifying the number of kids in our state that actually have a visual impairment. Those that come to Newview, for instance, I would say 8 out of 10 of our patients that come to Newview are not identified in the schools as having a significant visual impairment. And so we're not only identifying, we're treating, and then we're going into the school to provide those services. So it really is an underserved population because we're not identifying that number here, or I would even say nationwide.
We don't have a registry of vision impairment or eye disease in the United States like they do in some European countries, so we really don't have great numbers. The closest we have to a registry is what they have in Massachusetts, but other states don't. But if you take studies that have been done in other states and kind of extrapolate that to the population of Oklahoma, I think it's conservative to say that there are between 1,200 and 2,000 visually impaired people under the age of 20 in Oklahoma. We usually associate vision loss with older people, but it affects people of all ages very clearly.
And I would bet if you use some of the national prevalency rates, that could be tripled or quadrupled.
Yes, underreported. And I think one thing that happens is people do not know what to do with the child on how to assess the vision, because it's not a standard eye exam where they can read an eye chart and give you that number that tells you what's going on. So you can't classify them like you would an older person. You can actually get data on what they see.
Well, and I think too, I mean, at least with the kids, what we see is that, you know, some other disabilities are more easily identifiable, and so the kids will have a primary disability and they'll have vision loss along with it, but they don't really understand, like Dr. Riley was saying, like what that diagnosis might be, and so they'll get classified with that primary disability, but they won't get classified with the vision issue, and so that vision component won't be served, you know, because it won't be formally identified, so the child won't be getting services related to the vision loss. And, you know, obviously, I mean, if a kid comes to us, you know, we only see people with significant uncorrectable vision loss, and so it's very unfortunate that about 80% of our kids, when we get them, have not been provided specialized services and accommodations.
What is great at Newview, we've been able to develop programs around our summer camps. We've been doing summer camps for over 18 years, and now we've developed art programs, we've developed a transition program, for instance, so that we can teach kids cooking and be able to live independently before they graduate. What is not known is even the kids that are identified in the schools, if they're receiving proper education, they're certainly not getting services in the home. If it weren't for Newview, for instance, how is a child going to learn how to cook or, you know, fold their laundry or do their laundry for that matter? And so Newview actually goes into the home and provides those supplemental services, which are very important for a child with a visual impairment.
And as long as we are talking about children, and you mentioned summer camps, I know we have one here called OWL, right? So can you expand on that a little bit and just talk a little about that service and why it's important?
OWL camp is our favorite time of year. We love to break away and to go visit with the kids, but we now have actually 3 camps. So we serve kiddos from 8 years old through 21 now, and our OWL camps are meant to create an environment where our kids get to do the same things that their brothers and sisters get to do, whether it's rock climbing or swimming or boating or adaptive water skiing, for instance. We've got a camp in Tulsa for adaptive water skiing. These kids get to be normal, right? They are normal, but they feel normal, and the kids that we talk to after camp say, you know, thank you for creating this environment for us to come and be safe, but to do those things that people are telling us we can't do.
Great. And is that something you see outside of Oklahoma? Is that a common thing around the country?
Newview, Oklahoma is a nonprofit, and it is very prevalent at the nonprofits around the country.
Okay.
That is their focus. They raise donor dollars for that purpose in order. If we don't see these kids from day one when they're born, then the parents don't even know how to raise this child with a visual impairment or blindness. Medical science is keeping tiny ones alive, less than a pound. A lot of medical issues that surface when you keep a child that young, a baby that young, alive, where in the past they have naturally passed. So now, if that child has been kept alive and they're coming out of the hospital with cerebral palsy, with seizure disorders, with feeding tubes, all of a sudden, down the road, the parent says, I don't think they're seeing so well. But boy, I can barely get through a day with all this other stuff. So the further and further they get away from the moment when they should have started having intervention from New View, Oklahoma, the harder it is for the parents to let go, to let this little kid who's blind or visually impaired fall down, crack their head on a table, climb a tree, dig in the dirt, go out in the lake. They're afraid, and you can understand why.
Sure.
So this intervention from New View, Oklahoma, and the other nonprofits nationwide is extremely important.
Well, and I think too, when Roxanne talks about, parents, I mean, we all have, those of us who are parents, we all have that instinct to protect our kids. And so when you have a child who's blind or visually impaired and you haven't maneuvered through life blind or visually impaired, it's very easy for the parents to hold on so tight to the children that they don't really allow them to do the things that we kind of take for granted or do naturally, that when kids play and they explore and they hurt themselves, they learn a lot of lessons that carry on to adulthood, right? How to be independent, how to take care of yourself, how to make decisions and all of those kinds of things. And so if you're not provided that opportunity, it's not just about being a kid, but it's about developing those skill sets that will carry them into a productive adulthood. And a lot of that stuff, it's very difficult to make up. If you lose, X number of years of that kind of development as a child, it's very hard when you turn 18 to all of a sudden be cast out into the world and be successful and have the skills that will enable you to do that.
Mine learned at age 6 the lesson about not rollerblading in the kitchen. He really hated that cast. Yeah.
There's also a strong reason to do these camps and other activities with children for socialization reasons. Some of these visually impaired kids have very supportive families and lots of friends in school and do just fine, but a lot of them feel as though they don't quite fit in their normally sighted world that they live in. And so to be together with other kids who have the same problem for a period of time can be a very important experience for them.
I've been a counselor at the camp, the water ski camp, for 3 years, and I've gotten to watch the kids grow from when I first met them 3 years ago. And what I've seen is all of a sudden the child is happy to use their cane because the other kids are. Or maybe they're going to wear their glasses because the other kids are. So it's quite a good peer pressure in a positive way for the kids.
Because they fit in.
They fit in, and all of a sudden they're more independent. By the end of the camp, the parent is like, what did you do to my child? So it's been really beneficial
in a positive way.
In a positive way.
But that's the summer camp experience for everybody, as they come home more independent.
Our most independent camp is the transition camp when the kids are at like 18 and they're put, 2 weeks in a hotel, and they're taught how to cook, how to look for a job, what to do when the fire alarm goes off, how to go to college, how to get around town on the bus. And I think that is a big transition change for the kids to help them be more independent.
What is beautiful about the camps is it is another mechanism for us to identify kids with visual impairment. And so many of our kids that come to camp, they've never had a low vision exam before. And so, the benefits of having a doctor that's willing to throw pennies on a floor in order to see a child, see how they see, or do an M&M exam, to get on the floor with a kid and to be able to really identify what are they seeing. Most of these parents have been told your child's going blind. And, they haven't had a proper refraction or, just a proper exam, or for that matter, a doctor who will sit down and explain to them really that they're not going to be blind. They have limited vision, and this is what we can do to help them. And that's a beautiful part about adding this low vision component and having Dave Leverance and Judy Riley pretty much working with us and working with other institutions now to identify kids and seniors or working age adults and identify what their vision is, but correcting it and maximizing that vision.
Well, I want to say too, though, that our when we talk about the low vision exams, whether they're for kids or adults or our seniors, Newview, we don't cure anything. So we don't do disease management. What we're worried about is how a person's functioning, right? Dr. Raleigh, their functional vision. And so, it's really important. I mean, you can get information from an eye exam, but where we really provide a lot more information is our doctors and our therapists watch how the person's, functioning in their environment, and really gets good information about what they're seeing that doesn't necessarily just come from an eye exam. I mean, you have to kind of watch how they're interacting with things. And so, we really improve a person's functionality. We don't do the disease management part of it, nor do we cure anything, but we can certainly make things better for all of the people that we see.
We talked about young people a lot, but I think you brought up an excellent point about modern medicine and expanded life expectancy at both ends, and with baby boomers being what they are, I would guess that we're going to see, especially in the coming few years, more and more people in the 64 and over population who may be experiencing problems at that end of their life rather than at the beginning, and I would guess that's kind of a looming thing on the horizon that is likely to...
It's here. It's already here.
So,
statistics may bore people, but there are 10,000 baby boomers turning 65 every single day for the next 20 years. There's projections that could be 15.9 million baby boomers who will need vision rehabilitation services over the next 20 years. It's a projection, but that's a guess, based upon some of the major eye diseases that affect seniors. So macular degeneration, glaucoma, diabetic retinopathy, I call it our hit parade. And these folks, think about having a lifetime of sight, and all of a sudden, you just don't see so well anymore. It used to be that there were multi-generations living in a one house. Granny just earned her time in the rocking chair on the porch. We're seeing these baby boomers coming at us now. The World War II and the Depression era that we have been serving always said please and thank you. Baby boomers, they're the protesters. They're the demanders. They're the ones that worked 15-hour days. They are coming in, they are the first adopters of technology. They're not coming in as previous generations, and we're happy to learn how to successfully pour a cup of hot coffee. They're coming in and saying, I want to FaceTime, I want to continue working. I don't have a pension like other people, my parents had. I have to keep working. You need to make me able to work and able to stay on my technology. That's done first through the low vision exams, through the treatments through the ophthalmology, low vision exams through optometry, and then through services teaching someone how to use that technology, how to be safe in their homes, how to travel independently. If your bus stop changes, how are you going to get to work in the morning? That's all what Newview, Oklahoma does.
And what are you guys seeing locally in an aging population in Oklahoma, and it sounds like those are pretty universal needs around the country that aren't endemic to one place, but what are we seeing here?
Well, I mean, I'll speak a little bit to that. So, actually in Oklahoma, we're seeing incident rates a little bit higher than what we see nationwide, and a lot of it is tied to poor health outcomes. I mean, there's, when you talk about diabetic retinopathy and some of the populations that we have here in Oklahoma, I mean, diabetic retinopathy, diabetes is more prevalent in our Native American population, just in terms of, we have higher obesity rates and the high blood pressure, all those things, kind of play into the vision loss. I mean, as far as Newview goes, I mean, I will say that the largest number of people that we're seeing are seniors who are losing their vision to age-related eye diseases, and the most prevalent cause of that vision loss is age-related macular degeneration. And so, I'd say about 74% of the people we see are seniors. About 56% of those have age-related macular degeneration, and then we've got the glaucoma, the diabetic retinopathy, but at higher rates than what we're seeing nationwide. And and quite frankly, I mean, we're just, like you said, we're just all getting older. I mean, we're living longer, and so when you start getting people in their 80s and above, I mean, the rates of significant vision loss really increase at a very high level.
Over 80, it's almost a quarter.
Right.
People have vision impairment.
And so if you're living into your 90s, then, we're providing a lot of services for that, 80 and above age group, because they still want to live independently. We don't want to, for people to have diminished quality of life, for them to not be able to make those personal choices about where they want to live and how they want to live. And so, with very minimal services, really, in terms of our seniors, if they're just dealing with vision loss, really just 6 to 9 visits with us, I mean, when we're going in their home, can mean the difference between them going into nursing home care and being safe and independent and living in place.
Or falling and breaking a hip.
Oh,
Or
right.
opening a can of dog food instead of a can of corn.
Or medication management, taking the wrong
That's right.
medication. I mean, we work with all of those issues, and so
One of the climbing issues, which is not a progressive eye disease, but it is prevalent, are stroke. Individuals that have had stroke, and I'll let Dr. Riley, Dr. Leverance talk to that effect, but we're seeing a lot more patients who have had stroke and have visual deficits come into our clinic. It seems as individuals are living longer, they face that issue more, and when people think of stroke, they don't think visual deficit. They're focused on paralysis. They're focused on, what are we gonna do with mom and dad, in terms of the physical component, but the visual component.
We are blessed at the Tulsa Clinic. Our occupational therapist came from St. John's Neurology, so she came with a background of already dealing with people that had strokes, and then we found so many good things, Pele Prism, on helping them. When you have a stroke, you can lose half of your world. You can lose half of what you see, and then you have other issues. You might have double vision. You may not be able to move your eyes where you want to, and you're trying to heal a body that is maybe paralyzed on one side, and you can't see and make yourself move to help heal that body. So we kind of do a total person, occupational therapy, vision, and get them going back to being more functional. But one thing that I've noticed the most is depression. When you've had a stroke, when you've lost vision from macular degeneration, and you kind of hit on that, Roxanne, when you were talking about the change in your life can lead to the depression. And there are studies that prove that if you've had the vision rehabilitation portion, not just here's a pair of glasses, here's a magnifier, but someone that shows you how to adapt, depression goes away. So when we start with a patient, we screen them for depression. When we're done, in about 6 visits, we'll screen again, and it is amazing. Just the changes in their face, how they walk into the clinic. So that's one of the cool things we've noted with our elderly patients.
And that's without medications.
That's without
antidepressants.
medications, yeah.
Certainly depression is a really big factor. The rates of depression among the visually impaired is about 3 times higher than normally sighted. And the rates of multiple falls is about double. So that's a really big factor. Falls are a huge problem in the elderly population in both maintaining their independence and in overall health care costs. But the stroke is a really good subject to bring up. There are about 800,000 people that have a stroke every year, and about a third of them will have this half of their vision loss that Dr. Riley mentioned, where you lose the vision on 1/2 of your visual field, which is really a bizarre thing when you think about it. And most people come in and they don't really understand what's going on, because half the time they say, well, I lost the vision in my right eye, but what they really mean is they lost the vision in the right half of both eyes, and it can be right or left. But it's such a bizarre thing that when it happens, people don't know what's happening to them.
And our younger people having strokes that still want to drive, still want to go to work, that's a challenge for them to kind of get over that vision loss and continue to be a productive, happy person.
Look, we talked about the young and the old, right? And some of the ways to adapt and learn to function in the house or public transportation or at school. There's a huge group of people in the middle who are still in the prime of their careers,
Yes.
their working lives,
Yes, absolutely.
who I assume would prefer to be productive and earning a living and contributing to the world around them. So maybe let's talk about that age group for a little, the working adult age group, and what services are available for them through NewView, and maybe you can shed some light on some of the ways that group is affected by impaired vision.
The beautiful part about our program is, we're able to get individuals now in through rehabilitation and get them the skills to live so that they can work. So individuals that lose their vision, whether it's progressively or all of a sudden, most of the ones that lose it progressively, they're just they give up. They give up working, they give up living. And so we try to get in there, provide the rehabilitation through the low vision clinic, but also the other services. But then we can also provide employment for them, whether it's in their home or working with their employer to retain employment. And so really there isn't anything anyone can do besides the driving factor at this point. They can do anything. Technology pretty much has equalized the playing field. So
we do. For our working age adults, really the game changer has been the advancements in technology. So once we get them through the rehabilitation, and they can do rehabilitation while they continue to work too, because it's very difficult if someone loses their vision as a working age adult to just not have an income or to or a decline in income. And so we want to try to keep them working, but the computer technology, the optical character recognition, the voiceover technology, I don't see one on the table right now because we didn't bring in our iPhones and stuff, but iPhone and iPad technology is the most accessible technology out there. You could turn on the accessibility feature and have a lot of voiceover. We employ, like I said earlier, we're the largest employer of people who are blind and visually impaired in the state of Oklahoma, and a lot of that employment is driven through the technological advancements that we have. You can do accounting, you can do purchasing, you can do CNC machining, you can do really anything that you want to do.
Absolutely. That with technology, it's equalized the playing field for an individual to be able to, I go back to that live to work, because it's so very important. You can use technology to be able to buy your groceries now, right? You can get your pharmaceuticals just on the internet. If you can access that technology, you can also pretty much do any job as long as you can learn that technology. And so, as Lauren mentioned, we provide that rehabilitation both on the job and those that are not working. Unfortunately, we try to get them to a point where they can be employed again. The interesting fact is most individuals who lose their vision, though, have no idea what someone who is low vision or does have significant visual impairment can do. They've never seen someone work that can't see very well. So you ask them, what do you want to do? And they'll go, I have no clue what I can do. So you have to provide a lot of counseling, and so you pretty much can do anything.
I think on the other side of the coin, Kathy, is the responsibility of the business community to open their eyes, literally, and their ears and their hearts to say, I'm going to give this guy a chance or this lady a chance to do this productive job. We have most businesses, you apply for a job online, and those websites and those online applications are inaccessible to people who use screen reading technology. So how can you even get in and get a job if you can't go through the normal process of applying for that job? There are proprietary softwares that large companies use. They need to open their doors and invite in a rehab engineer who can come in and make the screen reading software talk to their proprietary software that's within their company. There is a responsibility on this business community in the United States to stand up and say, we are here to employ the whole community, not part of the community.
Yeah, and I think, just in terms of what Roxanne's talking about, the unemployment rate amongst working age adults who are blind or visually impaired is still over 70%. And so, and it's not because those individuals are not capable of doing the job. There just continue to be so many barriers to employment, like what Roxanne is talking about. And we run into it every day, and it's not intentional either. It's just you don't know what you don't know. And so you think that, you know, as business owners, you know, you think that you're in compliance, like with, you know, Americans with Disability Act, and that if you're doing those things, then of course, I mean, everything that you're doing is accessible, when in fact it really isn't. I mean, and we have challenges within our own organization. You know, when we load a new software program, or, you know, our accounting staff, I mean, it doesn't always play well, and so, you know, we have the expertise to be able to create those pathways and to be able to assist business owners in doing that. And the last thing that we want is for someone to lose their job. It's a lot easier to keep someone in a job than it is to retrain them for another career. And so, you know, but I do think that one of the biggest challenges, though, is for people to know that resources are available. And I think that's really, you know, one of the messages that we want to get out is, more often than not, people that have been diagnosed, you know, are having issues with significant vision loss, they don't know where to go. I mean, they've never dealt with vision loss. They don't know anybody who's experienced that vision loss. And so if you never connect with the resource, then generally the natural outcome is going to be that they become unemployed. They can, you know, become homebound. They, you know, start dealing with the, you know, the depression, the isolation, the, you know, all of those things, and really get to a point where they can literally shut down. And so, you know, what we want to say is, you know what, you don't have to be there. But the earlier that we see those individuals, the better the outcome is going to be.
We've had some really good successes. You know, if you're a person that's been working, created a career, and you're valued, your company will do anything to keep you working. So we've had a couple patients where any technology the patient needed, any time for training, the company allowed us to do the training. So our occupational therapists would go to the job site, adapt their software, adapt their work environment, bring in technology so that they continue to work. And it's so cool to see those people again in 6 months, again in a year, continue to be successful. So
yeah, I think we've had some success, but I think that is pretty rare. What we find are most employers, as Lauren mentioned, don't even want to let you in the door to deal with their software issues. And that's what we're running up against as a whole. Besides the barrier of just getting the employer to let us in the door, one thing I'd like to mention is the barrier for transportation. You know, there are transportation options available to get someone to a medical appointment. That's not the issue here in Oklahoma. There are not transportation options to get someone to work. You know, you've got to live in a pretty small quadrant, and even within that quadrant, you do not have sidewalks. And so even if you are able to get to a bus stop with a visual impairment, being able to navigate to your work site, that's a major barrier to employment here in Oklahoma.
And we are a rural community, so there's not always a bus to be ridden.
There, you brought up a couple points, and I don't know how to mesh them, so we'll explore them one at a time. But I'm interested in, and one, you know, we're the Journal Record, right? So we're interested in business and state government. So we do a lot of things with dollar signs on them. And you mentioned that very high unemployment rate among the visually impaired, and I have to think that in addition to the personal economics of not working or having a significant decline in income, that there has to be some public finance issues there. There has to be some greater cost to society on the one hand, to taxpayers on the one hand. Can you talk a little bit about that?
Absolutely, and I would love to talk about this. You know, and I want to reference, you know, most of us around here are familiar with it, but in 2013, Prevent Blindness America did an updated economic cost of vision loss in the country. And so nationwide, they put a dollar amount on people with vision loss who were not getting services, you know, and it had to do with not just the direct costs, but the indirect costs in terms of lost productivity, in terms of, you know, accident and, you know, all those. $139 billion cost to the country. If you go and you look at the numbers that drill down into Oklahoma, the cost to us on an annual basis is $1.7 billion. I mean, and think about that in terms of our state budget, and so what you're looking at is, you know, I mean that's the cost from children on up to seniors. So, you know, a lot of that, the bigger dollar amount, is in what you're talking about, the economic cost in terms of, you know, what you would consider lost productivity. And, you know, someone not contributing, but, you know, really taking Medicaid, nursing home care, you know, for our seniors. We did kind of our own little study in Oklahoma a number of years ago and really did some surveys with nursing homes. And we found that close to 40% of people who were in assisted living and nursing home care were there because of vision loss. I mean, it's a huge... It's a public health issue. I mean, and it's one of these issues that we don't talk about a lot. I mean, I know that you know, we talk about mental health, we talk about just, you know, the rising healthcare costs, but untreated vision loss creates a huge economic burden on us. And when someone's not working, you know, they're getting income from somewhere. So they may be on SSI, they may be on SSDI. You know, if we are pushing kids through school and they can't get jobs, I mean, they're going to be a lifetime of being dependent on the federal government. And so it seems to us, and you know, Roxanne's done a lot of policy work. I know that I have, Dave Leverance has, is that, you know, if we invest in these services on the front end and really expand the ability to access services and increase, you know, the capacity for these services, it's a huge payoff on the back end. I mean, if you can keep a person out of a nursing home, I mean, that's $50,000 or $60,000 a year, you know, in terms of what Medicaid is having to put in there. If you can take a child and give them a good education, and they have the ability to earn an income over their lifetime rather than being dependent on the federal government, I mean, that is a big deal. You know, I mean, I'm astounded when, you know, I saw those numbers, and in Oklahoma, the cost of this is $1.7 billion in our community. I mean, we can fix that. I mean, we can fix that. We put people to work. We give them good educations. We provide the services that our seniors need to keep them independent.
You fix it for a lot less than $1.7 billion.
That's exactly right.
I'm happy to take the 1.7 billion.
Yeah, but the truth is that we don't. I mean, the services that we provide are not generally covered services. I mean, a very small part of what we do is actually covered. I think that vision care is one of the most underfunded and neglected services. I mean, it's generally can be not covered at all under your health insurance plan, and it has a big price tag attached to it, and we really need to be doing things differently.
May I add just a little bit on to what Lauren just said about not covered? If you break an arm, you get a cast and you get to go to physical therapy for a long time. If you lose your vision, nobody covers the cost of what it takes to maintain your independence or to purchase specialized equipment. You can, if you have a stroke and you need a wheelchair, you can get it. But if you lose your vision and you need a white cane, nobody pays for it, except for the money that's raised by New View, Oklahoma through their manufacturing and employment program and through philanthropic means. And I tell you, representing a national network of these nonprofits, I'm scared to death of the new tax laws that have just been put into effect. It's going to discourage philanthropic support. So people have just got to come forward with the goodness of their hearts and not their tax forms in order to keep programs like this alive.
I was thinking when you were talking, if my heart stops working, I sort of, I know what to do and I know what to expect and I know what my insurance is going to cover. If my eyes stop working, I have no idea.
Most people just stay at home. Their family member will take them home and they'll sit on a couch. And it is considered a catastrophic event, and yet there is no funding to provide comprehensive services that are necessary in order to get someone back to what they were doing.
I would imagine there's a great feeling of helplessness
Yes.
in that situation.
Which is where you're helpless, the depression sets in. Lauren talked about the 40%, ending up in nursing homes or assisted living with nursing support is so expensive. And you're put into a population just because your vision has deteriorated. You're put into a population with other individuals who have other significant issues. That's where the depression sets in. When you could be living at home and doing everything independently, where you could regain employment. But again, the majority of individuals are just that. They're just sitting at home.
I'm going to come back to money for a minute. It seems to me in listening to you talk, there's sort of two components there that I'm hearing. One is if an individual through loss of vision finds themselves unemployed, right? Now I'm getting perhaps some kind of government assistance or some other form of public support because I'm not able to support myself at the moment. If I'm doing that, I'm not paying income taxes, I'm not paying employment taxes, payroll taxes, and that kind of thing. So I'm taking money in, but I'm not paying into the common good. To summarize, I guess, right? And then from the other side. Whether it's Medicare or Medicaid or some other form of government medical assistance, paying medical bills in one way or another, whether that's going to a nursing home because that was someone's only option or appeared to be their only option rather than remaining employed and self-sufficient. So in addition to that patient not being self-sustaining and paying taxes, the other side then for that person is that someone else is paying in one way or another, right? Is that a fair assessment?
Because they would go into assisted living or a nursing home prematurely, adding to the overall health care cost and cost to society.
And so is there, you mentioned $1.7 billion just in Oklahoma, but if we, is there a measure, has someone quantified what those costs are, both in terms of lost productivity, but also in terms of cost to society and all the individual costs involved when that's not addressed?
That's actually that Prevent Blindness America report that came out in 2013. It has, I mean, it's a very, very comprehensive report, and it does take categorically the breakdown of that, and so you can see, I mean, not just the age breakdown. So they'll divide it, in very young children, and then this age group, working age adults, and seniors. So you can see the impact of each of those age groups. But then they'll split it the other way too, where you can see the direct cost of medical care, the cost attributed to nursing home care, lost productivity. We don't have all those numbers here, but it states in that report too that they think that they were conservative, that these were very conservative estimates, and these were actual costs that they could quantify. I mean, when we think about the monies that we put into to every other, all other kinds of healthcare costs and disabilities. I mean, vision loss is the most underfunded. When you talk about seniors who have reached the point of, like what you would consider legal blindness, at the federal level, we only put in $34 million, $33 million to address these issues across 50 states. I mean, so, if you look at the amount of money that would be allocated to Oklahoma, it's just over $300,000 that we get at the federal level to address these issues. And so, like Dave was saying, I mean, we could invest a lot less than $1.7 billion in the state of Oklahoma and have a huge return if we really got serious about this. And, the other thing that I would mention is that when we talk about vision loss, I mean, and I go and I talk to a lot of people and they think to themselves, well, I don't know anybody, who needs your services. And then you start mentioning things like, well, macular degeneration, I mean, which is the largest number of people that we serve. And, everybody in the room goes, oh, well, I know someone with macular degeneration, or my grandmother is dealing with that, or I had no idea that that's what you're talking about, and they said, man, my grandmother passed away last year, but she struggled for 10 years. I wish that we had known about you because it could have, made improvements in her life. And so the incidence is way more prevalent than anybody really wants to acknowledge. But if you really think about it, there are people in your life that I'm sure have struggled with the types of issues that we're talking about.
We've talked about the how it affects across the age span, and about how it affects more people than we realize if you combine all the different forms of and causes of vision loss. Even by the very conservative estimates put out by the Eye Disease Prevalence Research Group, which is rather dated data by this point, if you put all the visually impaired people in Oklahoma in one place, it would be at least the 8th largest city in the state. We're talking 60,000 people, very conservatively. So that's a lot of people, and it would make a lot of people will be surprised to know that. I think.
I want to walk through just sort of a semi-hypothetical scenario because I think it might make some of those issues easier to understand. And you mentioned that everybody knows someone, right? Everybody has a story, and I suspect it's one of those things where nobody really thinks about that, and then you get in a room and everybody raises their hand because everybody has a story, right? So, so for our semi-hypothetical deal here, I have a story, and we'll just use that to start. I'm a sailor, right? I have a sailboat, and one of my good sailing friends is having to greatly restrict the amount of sailing he's now able to do. He just turned 75. He has macular degeneration, I think wet macular degeneration, and his vision is declining pretty rapidly. He used to take his boat every year and go sail up in Canada all summer and live on the boat, and he's realized he no longer feels safe doing that, but feels safe still locally in the areas he's very familiar with. And his understanding is that his disease is going to progress, that it's going to worsen as he ages. So I'd kind of like, his name's Dave. Sailor Dave. And he's a real guy. I didn't make him up, but I'm kind of wonder if you might lead us through first what typically happens with someone like Dave at that age, and kind of how that progresses and sort of where he ends up with all the issues we've been talking about. Does he end up in a nursing home prematurely when he gets past 80? Does do his odds get significantly worse? What's kind of been the typical path? And then I'd like to sort of walk through, if Dave were introduced to NewView and some of the services that are available to him, he's otherwise in excellent physical health, what might those outcomes for Dave look like if the funding were available and he was aware of the services?
Before we get into the official answer, I want to tell you that I learned how to sail from a blind man.
Oh, excellent.
And I led the Miami Lighthouse for the Blind, and I sailed every Saturday on Biscayne Bay with the blind sailing team.
Wow.
So there is a future in sailing.
I think Dave needs a little trip.
Yes, he does.
A trip to learn. and that's probably part of what we do is show them other people that are able to do what they lost and give them that knowledge on how other people do that. So typically when someone would be referred to us, we would evaluate their whole visual system. We'd look at old records, we do a complete eye exam, look for any hidden things that might make a small improvement. And you talked about contrast, the ability to see black on white, glare, and address those issues and try optical things. I mean, he might do well with the telescope that he could use to see the detail far away. If he's reading a map, perhaps some sort of magnification to help him look at the map of the lake that he doesn't know about. He could have technology that would help him. Could use any type of electronic device that we have to magnify, change contrast so he can see things. I don't know, what else do you think, Dave?
I want to back up a little
yeah,
bit.
to
What
what
Dave, if Dave does not have access to these services, for instance, so Dave
Yes.
just was diagnosed with wet macular and his vision is progressing. And what's typically going to happen if they don't have access to services is they're going to be faced with a situation where first they're going to have to give up their keys. And that's
No
just
driving.
really scary. How am I going to get to the store? How am I going to take care of my family? And through the many losses that they would experience, the day-to-day losses, not being able to read, not being able to access your computer, not being able to just function in your home, progressively Dave would become depressed. And then Dave's family members would look at that depression and they'd think all sorts of things and perhaps start considering that Dave needs to live in an assisted living center and or moving towards a nursing home prematurely. That's if Dave does not have access to services. Now, if they
Can
do
I-
find, go
Yeah,
ahead.
can I say one other thing? Dave's already on that path because you've already said that Dave is already giving up things, and so it's and I would venture to say that Dave has not just scaled back on his sailing, but there are already other things that he is making adjustments and sometimes these losses are pretty gradual, but over time they're really big. And so, this day you may give up, you're not sailing as much, and then you're not reading the paper, and then you're not going out as much, and then one day you wake up and you haven't left your house for a couple of months or longer. And so it's just really important to address these things early on. And I before we get into kind of some of the techniques, and Roxanne mentioned the blind sailing team. These are, we'll share real life stories. We had a guy losing his vision, and he was a rancher, and so he had given up riding his horse. He couldn't take care of the barn. He wasn't able to manage. Our team went out there, and taught him new ways to organize, taught him how he could still, rope his calves and stuff. And so he's back ranching again. He didn't have to give up any of those types of things. And for everybody it's different. And so, what we really do with our patients when they come in is, if someone's never cooked before, we're not going to teach them to cook because the likelihood is they don't want to cook, But if someone is, sewing or ranching or sailing, we want to identify those things that are really important to them because it's about quality of life and not having to give up those things. And so teaching them with whatever tools we have to continue to do the things that they want to do. And for someone with macular degeneration, a person with macular degeneration generally will never lose all of their vision, so they'll still have usable peripheral vision. And I like to talk about macular degeneration in terms of like reading. It is not unusual for us to get a patient in the office who has lost that central vision and who is not reading. They can't read their mail. They can't do those things. And for our doctors here to get enough information with them and understand what their usable vision still looks like and get them reading print again. With lighting and magnification and high contrast, Dave could still read his maps. He could still continue to do those things. I'm not saying that, you can do everything or that everything's going to be perfect, but there's a lot of ways to skin a cat, and you know, we're all about keeping that person doing the things that bring them joy, you know, and quality of life. And I would suggest that Dave has probably already lost some of that.
So what then if we have this group of people who, regardless of age, the children we talked about at the beginning, the aging population, or the kind of, you know, mid working life adults, there's a group that are struggling because of vision loss for one reason or another. Who we've talked about all the you know, negative things that can happen with that. And then we have NewView, who can provide services to help that person get on a better, more productive, happier path. So what are the hurdles that prevent, you know, this person from becoming that person? What stands in the way?
One of the big hurdles is that a lot of people just don't know that the services are available.
That's the biggest, I think.
That's huge. It prompted the American Academy of Ophthalmology to recently make a video which says if you're not providing or referring for low vision rehabilitation care, you're not up to the standard of care. It's basically saying you're not doing your job as an ophthalmologist. Now, how much effect that video will have, I don't know, but it kind of speaks to the point that I've been in this field 40 years, and we've had the problem the entire 40 years and beyond, that people come in sometimes actually very upset when they find out that they can be helped, and they could have been helped 10 years ago, but nobody told them. And just lack of awareness is the biggest hurdle. And then another big hurdle is the finances. How can they afford what they need? Because without a nonprofit like NewView to help them, some of the services can be provided through their medical insurance, but many times there are gaps in that, and particularly when it comes to any equipment that they might need and some of the training that they might need.
And where's the fix for that?
We've done a lot of trying to get word out about what we provide, visiting doctor's office, speaking at seminars, going to seniors meetings. That's where it starts, but success is our best advertisement. When we have patients that go back and say to their doctor, best thing ever you did for me, we get another referral. So I feel like we're just kind of trying to empty the bucket one spoon at a time to get through it. What do you guys think?
Yeah, I will say that. I mean, you know, we do a lot of marketing and talking, but I do have to say that, you know, in addition, like Dave mentioned, I mean, funding these services is not Sailor Dave, not Sailor Dave, Dr. Dave, Dr. Dave. But, you know, I work, and Roxanne does too. We do a lot of work, and in particular Roxanne, on addressing policy issues. I mean, this is a public health issue, and it's a public health crisis, especially when we talk about our seniors and the baby boomers and the rate at which they're losing their vision. You know, we've had a difficult time. I mean, you know, talking to legislators, I mean, it has to be a policy change at the national level that we're going to put more money into the system to provide the services. I can tell you at NewView, we have more demand for services than we can provide. You know, I mean, that's just the reality of it. I mean, you know, and so we get between 80 and 100 referrals a month. I mean, think about that. And Dr. Riley can see 4 patients a day. You know, I mean, a low vision exam takes a long time to do that. So we know that there are a lot more people out there, but, you know, we have to manage to, within our capability and our ability to be able to fund the services, and it would help if there was money out there to, you know, invested into vision where we could really expand the capacity. I mean,
only
not
a
just
fraction of our services and tiny fraction, are covered by Medicare or third-party insurance. But we have to get into a person's home. We have to be able to modify their home environment so that they can live safely and independently. We've got to be able to teach them in their community. We're a big state, and so providing these itinerant services and having a staff to support our physicians after they've had their low vision exam and made the recommendations, it's very costly. To be able to keep that team together and be able to send them out. You could drive for 3 hours here in Oklahoma, and you're going to be able to work with a patient for all of an hour. You're not going to do much in that time period, right? So we're in a quandary. Again, how do we serve those out in rural areas at a comprehensive level that they need, that they deserve? How do we fund even those within our major metropolitan areas at a level which is really going to get them back to work? So, without the community support and additional funding, it's next to impossible. We keep doing our best, but...
And it's not, and our services are not a one and done kind of deal. I mean, most of the people that we work with have progressive eye diseases, and so, they don't need services just one time. They may need them multiple times over, a period of time. Our children are lifetime. I mean, when you talk about providing the services for the children as far as direct services in the schools and stuff, I mean, it starts when they're babies and you see them all the time. So when we're getting 80 to 100 referrals per month, I mean, our client base just continues to grow. I mean, it certainly doesn't, drop off at the rate that we're increasing, and so the need just becomes more and more and more and more.
I'd like to add to this that there is the awareness, there is the funding, but there's also the human component. And we do know that the word blind scares people to death, and we use that term loosely. Going blind. A doctor might say, oh, you have macular degeneration, you're going blind. That, all of a sudden, every sense has been turned off because that's the only word you heard. So we can do all the PR, all the marketing, and bring it, we think that we've hit every population out there, but in reality, you gotta wonder if people aren't just like tuning it out, saying, not me, not me, not me. I don't want to be blind. So we're trying very hard in this field to use the words visually impaired, vision, and that's even confusing, but vision loss. And then once they come to us, let us define if it's enough vision loss or a progressive vision loss, but it's a human condition. We're told, and I wish I could tell you the research entity that did it, but we have been told over and over and over again that people fear cancer and they fear going blind second. So we're just second to the big kahuna, and I got to think that if we're not going to be going first, because there are so many interventions now for cancer that we're not seeing in the vision field.
We've also talked about the gaps in the healthcare system that doesn't cover a lot of what we do. There's also just the access to healthcare in general. If you look at, again, the results of the eye disease prevalence research group, you'd be surprised how many people in the United States, one of the richest countries in the history of the planet, who are visually impaired because of cataracts. A totally treatable condition. And we know, again, when you look at international visual impairment, you expect to see that the number 1 and 2 causes of vision loss worldwide are cataracts and refractive error. People who just need really strong glasses, believe it or not. But to see that in the United States is shocking and, quite honestly, shameful.
I want to conclude with asking whoever wants to volunteer it to provide statements to two groups. We talked about policy issues a little bit. We talked about funding issues a little bit. And I'd like to give one of you the opportunity that if you had a chance to sit down with the state legislators all in one room and say to them, this is what we need and why we need it, what would you say? And then I'm going to ask you the same question about donors and foundations.
So with our legislators, I mean, there needs to be a recognition that this is a problem, and it's an economic problem, and so we need to recognize. I mean, it's been shown that if you invest $1 into services, that you get a $4 return on the back end. So let's look at this and talk about it as a public health issue, and how we're going to invest dollars in the front end so that we can have huge returns on the back end. I mean, it really is pretty simple math. I mean, you know, we want educated kids, we want productive adults, and so, you know, the problem is solvable if we make the right choices and the right investment.
And to donors?
You know, I say the same thing to donors. You know, I think that you know, we're all impacted by this, and you know, we're not going to change the policy overnight. I mean, we've been working for years to try to change the policy, but philanthropic dollars go a long way, and I tell them the same thing. I mean, every dollar that you invest, you know, your return is $4 back to the community. I mean, you're not just helping, you know, individual lives, which is very important. I mean, to be able to connect it to an individual and maintaining quality of life, or, you know, education or productivity, but it really is an overall benefit to the community and an economic benefit, and there is a real life dollar return on that. And so I would ask that you know, that they think about vision loss differently, and think about investing in our programs and services, because, you know, like I said earlier, I mean, I don't go into a room where I talk to a group that a large number of people in that group have not been impacted by vision loss. I think it's just one of these things that we don't talk about a lot. We don't know the resources are available, but can make a huge difference in the lives of the people in our community.
I want to add to that I see from a national perspective a lot of nonprofits inside this blindness, vision loss field and outside. The days of running charities are long gone. We must run businesses with a heart. And New View, Oklahoma is a business, and it's a successful business, and your investment will not go wrong. It's an important aspect of philanthropy these days, that you do your homework. Go in and look at their financials. Look at how they're managed. Come in and ask questions. Take a tour, and you will be proud of your investment in New View, Oklahoma.
And more information?
Well,
give a URL.
Well, you can find us at newviewoklahoma.org, and you know, we have a website. I mean, it's got all of our contact information. You can contact us, you know, via, you know, through Tulsa or through our Oklahoma City office. But certainly, you know, we serve statewide. So just go to our website and look us up.
Okay, thank you, everybody.
Thank you.